Kidney stones are known as nephrolithiasis or urolithiasis. That formed due to the deposition of different salts and minerals. Our kidneys separate the waste or minerals from our blood. These wastes and extra minerals excrete from our body through urine. If the concentration of minerals like calcium oxalate increases, these deposit in our kidneys and form crystals. These crystals or minerals combine and form a hard structure known as a kidney stone. Types of kidney stones. There are 4 types of kidney stones. Asterisk calcium stones, asterisk uric acid stones, asterisk infection stones, asterisk cystine stones are included. Calcium stones. Calcium stones are a combination of calcium and oxalate, or calcium and phosphate. Calcium is present in overdiet in large amounts even though oxalate produces in our liver. These substances deposit in the kidney and form calcium stones. Uric acid stone. If the concentration of uric acid increases in our body, it deposits in our kidneys. That becomes the reason for uric acid stones. Infection stone. Suppose our ureter tract gets infected by bacteria. Then bacteria convert acidic urine into basic urine. That becomes the reason for magnesium ammonium phosphate stones. That is also known as struvite stones. Cystine stones. Cystine stones occur in those who have rare hereditary conditions. That is also known as cystinuria. Cystinuria patients' kidneys couldn't reabsorb cysteine amino acids by urea. Cysteine deposits in the kidney form cystine stones. In people with cystinuria, their kidneys form cystine deposition from birth. Causes of kidney stones. There are no specific causes of kidney stones, but a few risk factors that cause issues. Dehydration. Dehydration means a lack of water in our bodies. In this condition, our blood gets more viscous or thick. And the kidney can't filter minerals during this. Even though minerals get deposited in the kidney, the chances of kidney stones may increase. If our diet has high protein, sugars, and salt like calcium, this can be the reason for calcium and uric acid stones. Such diseases or surgeries, like chronic diarrhea or gastric bypass surgery, can disturb the mineral balance in our body and can be the reason for kidney stones. As such, few calcium-based medicines or antacids, vitamin C, vitamin D, or medicines that treat migraine can be the reason for kidney stones. Symptoms. A stone stuck in the ureters causes severe pain in the abdomen, back, and both sides. Diagnosis. Kidney stones are diagnosed by blood and urine tests to find the reason for stones forming. Through this, we can prevent kidney stones. Treatment. Small kidney stones are treated by drinking more water, painkillers, and medicines that dilate ureter muscles. Even large kidney stones that cannot pass from the ureter can be removed surgically. A few surgical processes through kidney stones were removed. The extracorporeal, shockwave, lithotripsy, nephrolithiasis, ureteroscopy, and parathyroid gland surgery are included. In upcoming videos,